Medical News Roundup today, February 26, 2026. Headline 1. The Rising Crisis of Parenting Heart Disease. The study, a new report in the Canadian Journal of Cardiology, highlights a double burden for patients under 55. The data, global heart disease cases in younger adults jumped from 1.5 million in 1990 to 2.6 million today. Key takeaway: traditional medicine often ignores the unique stress of raising a family while recovering from a heart attack. If you're a parent in this bracket, your recovery plan needs to account for that emotional and physical parenting load. Headline 2. Breakthroughs, the lab-grown era. Lab-grown skin. Scientists at the University of Queensland have debuted the world's first fully functional lab-grown human skin, complete with its own blood supply, hair follicles, and immune cells. This is a game-changer for burn victims and skin grafts. 2-day oatmeal power. A clinical trial released today found that eating nothing but oatmeal for just 2 days reduced harmful LDL cholesterol by 10% in people with metabolic syndrome. Prostate warning. A shocking study found microplastics in 90% of prostate cancer tumors, containing 2.5 times more plastic than healthy tissue. Headline 3. Global health alerts and FDA approvals. Cancer approval. The FDA just granted full approval to Braftovi, incl, in combination with chemotherapy for patients with a specific BRAF V600E mutation in colorectal cancer. The Mpox update. A major Phase 3 trial published today in the New England Journal of Medicine found that tecovirimat, Mpox, while safe, showed no evidence of clinical activity against clade 2 Mpox in humans, despite working in animal models. Public health alert. A multi-state infant botulism outbreak has been linked to powdered infant formula, prompting an urgent alert for parents. The Living Well tip. Digital brain health. The 10-year trick. A groundbreaking study in PNS Nexus found that users who restricted mobile internet for just 2 weeks saw their sustained attention levels return to those of someone 10 years younger. Action step. Try a digital fast this weekend. Your brain literally has the capacity to reset its focus levels to a younger state. The New England Journal of Medicine Research and Review. The New England Journal of Medicine. FDA grants traditional approval to incl for metastatic colorectal cancer with a BRAF V600E mutation. Endocrinology news update. Revolution. Can we replace insulin? Plus major FDA news. The appetite hormone breakthrough. The news. Researchers at the University of Washington School of Medicine are revisiting a forgotten hormone that could potentially resolve one of type 1 diabetes' most dangerous complications. Why it matters. This hormone, traditionally known for regulating appetite, is showing signs it could act as a surrogate or replacement for some functions of insulin. Narrative tip. Frame this as a medical detective story, where a 10-year-old discovery is finally getting its day in the sun. The forgotten hormone that researchers at the University of Washington, UW, School of Medicine are revisiting is leptin. Based on research conducted at UW Medicine, including studies dating back to 2011, administering leptin can resolve diabetic ketoacidosis, DKA, a dangerous and potentially life-threatening complication of type 1 diabetes, even in the absence of insulin. The problem. In type 1 diabetes, the absence of insulin leads to high blood sugar and the accumulation of ketones, causing DKA. The researchers found that DKA is largely driven by the brain's response to low insulin levels, and that leptin can act on the brain to reverse this, effectively acting as a therapeutic agent for this complication. Clinical trial deep dive. The rise of the pill. The news. New Phase 3 Oasis 4 trial results just dropped for oral semaglutide. The stats. The pill version achieved a massive 13.6% mean weight loss compared to just 2.2% for the placebo over 64 weeks. The impact. This effectively closes the gap between injections and pills, removing one of the biggest barriers for patients, needle fatigue. Key detail. Mention the Million Veteran Program study released today showing that combining GLP-1s with 6 or more healthy habits, sleep, diet, exercise, slashes major cardiovascular events by 43%. Regulatory Roundup, FDA approvals and PDUFA dates. Fresh approval. Today, the FDA authorized desmopressin acetate oral solution for central diabetes insipidus. Why this is a win? It's the first oral liquid formulation, making titration much easier for pediatric and adult patients who can't swallow or split tablets. Rare disease win. The FDA granted accelerated approval to Lorges, pegsilarginase NBLN, for arginase 1 deficiency, a rare metabolic disorder. On the horizon, keep your eyes peeled. An FDA decision for Dupixent in allergic fungal rhinosinusitis is expected by February 28th. The Research Corner, PCOS and thyroid genetics. Alert! A major longitudinal study published today in the Journal of Clinical Endocrinology and Metabolism found that childhood sleep problems at age 10 are a significant predictor of PCOS risk by age 14. Thyroid breakthrough. A massive meta-analysis involving 2.9 million individuals identified 570 new genetic associations for thyroid diseases. Takeaway. We are moving toward a future where we can predict thyroid cancer or Graves' disease years before symptoms appear. Global events. Paris is calling. Event news. The 16th World Congress on Endocrinology and Diabetes is wrapping up its final day in Paris right now. Hot topics from the floor. AI integration, moving from standard CGM to predictive analytics that tell you where your sugar will be in 2 hours. LADA breakthroughs, retrospective data on using semaglutide for latent autoimmune diabetes in adults showed significant C-peptide preservation. Summary. Quick recap. New oral obesity pills are rivaling injections. The FDA is greenlighting easier treatments for rare diseases, and we have a new sleep to PCOS connection to watch. Rapid fire round. Memory and blood group. A small study showed that people with memory problems had type AB blood more than any other. WebMD. Malaria and blood group. Type O blood may help ward off this disease. You can get malaria when an infected mosquito bites you. The parasite that causes it has a harder time attaching itself to type O blood cells. WebMD. Hatha Yoga. This mix of challenging poses and controlled breathing helps you turn your awareness to being in the present moment instead of judging yourself and others. There's also evidence that a regular practice lessens anxiety and takes the edge off your natural stress response. Plus, it's exercise that builds your strength and flexibility. Go to a class and you'll get the benefits of socializing with other people, too. WebMD. That's your medical news update for today. Which of these updates do you think will have the biggest impact? Let us know in the comments below. Stay informed and stay healthy. Remember to consult a healthcare professional for any medical concerns. If you found this update helpful, hit that like button and subscribe for your regular medical briefing. Disclaimer: use the content after verification.